this is a sterile technique. Don't forget how to don on your sterile glove. So,
Is that part of the checkup?
yes, it's gonna be part, like sterile gloving with your Foley. Yes, you want to make sure, just like before you enter the room of any client, that you have all your necessary equipment, so it can save you time. I have my Foley kit, my sterile glove, my biohazard bag, because I'm gonna show you how to collect urine sample as well. Before I open my my Foley kit, I'm going to check the kit to ensure that it is definitely intact, not broken, okay? And then I'm also going to check contents are within this kit, right? Do I have everything that I need? Most kit, when they do come with sterile gloves, and then they'll tell you the size of the sterile glove. If the size does not fit you, you simply get the size that will fit you in that glove, okay? You are also going to check the size of the Foley. They can come in 12 French, 14 French, 16, 18, etc. It is important that you note the size because you need that for documentation, okay? So that when the next nurse or whoever's removing it, or if there's an issue, they can look and see, okay, it was this size, and they'll make the necessary adjustments as needed, okay? I'm also going to check the expiration date. Can't read with my glasses on. So, and it's on this kit is listed right here. It actually expires 2027.
Gotta make sure.
Okay. What else? Intact, and then also you'll see some kits, they'll have it listed actually on the cover. They'll tell you exactly how much to inflate the balloon. And here with this kit, it says inflate it with 5 cc's. It is very important that you inflate it with no more than that. The syringes that come in this kit typically are 10 cc's. You could either remove 5 so that you know you're only inflating 10, or if you know that you're gonna put in the 5 and no more than 5, you can just go ahead and insert the inflate the balloon with that 5, and I'll show you what I mean when I get to that step. But it is very important because the purpose of the balloon is to hold the sphincter so that the catheter stays in place, and if you overinflate, you can cause some damage. Okay, if you find that you need to inflate more than need to, then you may want to notify the physician, make a referral for a urologist of sorts, because you can cause harm. All right, so that is that. You need to know what side you're comfortable working with. Okay, so I am right-handed. Because I'm going to be inserting the catheter on this side, using this hand, I'm going to be on this side of the client. If I'm left-handed and I'm on this side of the client, you see how difficult it is for me as the care provider? So I will simply just go on the other side so that I can use my dominant hand. Does that make sense to appropriately insert? So just be mindful of that, because you don't want to be uncomfortable when you're inserting the Foley catheter itself. Now, also, I said you have to have your equipment. Just like with everything else, you're going to make sure you introduce yourself, let the patient know what it is that you're doing, assess for pain, assess for allergies, and get their permission to do what it is that you want to, that you need to do with the client, okay? And of course, perform hand hygiene. Hello, John Doe. Jane Doe. Jane Doe, my name is Judith. I'll be your nurse today. How are you feeling? Good. Okay, I'm going to be inserting your Foley catheter. Is that okay with you? Yes? Okay. Can you tell me your full name and date of birth? Jane Doe, August 16, 1986. Okay. It's okay. Are you in any pain? No? Any allergies? No allergies. Okay. Prior to you inserting the Foley catheter, you are going to do perineal care. You guys already know how to do perineal care, okay? Of course, let the client know what it is that you're doing to them, okay? Maintain dignity. Of course, I keep forgetting to say this. Make sure you provide privacy, of course, all right? Because you don't want their business out to the world. All right, I'm going to go ahead and provide perineal care. And of course, my hands are gloved. I provide the perineal care, and then I go ahead and cover the client back up. Get rid of what I don't need. Be mindful of your environment. Try to have only what you need to do the procedure. Don't have extra stuff that you don't need, because that you can risk compromising the sterile field. All right. Also, you may be working with limited space. If you don't have enough room, you're gonna have to work with what you have. Because some clients, they're like, there's 2 to a room, 4 to a room, or whatnot. You're gonna have to work within the limits that you are confined in. Now, when you have a sterile field, you never ever turn your back to the field. Is that understood? Never ever turn your back to the field. You notice I have 2 tables. You do not have to have 2 tables. I'm showing you an option. I'm going to use this table just to do my sterile gloving when I'm ready to, and then I'm going to use this table to do my Foley. If I don't want the second table, another option you can do is put your kit to the side, which you don't need to the side. I'll simply turn, and then I'll do my sterile gloving this way. Okay, that's another option. Whatever you do to keep the field sterile. All right, perineal care is already done, and now this kit, like your wound kit and your Foley kit, it is very important you open away from you. You can't get away with that. Okay, and yes, you will see different things done in the clinical setting. It is what it is. I open away. You can choose to keep this, or you can have a waste basket. Thank you. And when you keep this, you'll see people do different techniques, like just to keep this standing. Oh, it worked. Okay, cool. Okay. Do you have to do that? No. Okay. It's just to make life easier for you. Once I touch the sterile field, I can't do this with my sterile hand. So I'm going to tell the client, I'm going to expose you. All right. And can you please leave your, open your legs like a frog-like position. Again, you are always working within the limitations of the client. All right. So the client is exposed. And if you want to put like a little chucks here, you can, but you don't have to. All right. Notice what I do with my clean hand. The kit, you'll notice that the kit has a little latch, so to speak. Always have that latch facing you. You see it? And this. All right. I am going to pull the latch away. You must open the kit in this order. Always open away. And notice I am not over my sterile field. My arm should not be over like this on my sterile field. If I see that, you will, you know what it is. What I'm going to tell you. See you next time. Okay? So think like a little C. I don't know. Form like a little C with your arm so you are not away. And I need to put this up a little to make myself comfortable. Okay? So, open away. But try not to bend all the way down like this either. Okay? Just kind of keep it straight. Taut. All right. These drapes, they have the tendency to fold back. So one of the things, again, if you kind of pull taut carefully without tearing it, of course, sometimes that helps.
Is that also limited to like the 1-inch border?
It's also every sterile field 1-inch border. My bare hand, this cannot touch right here. Okay? And then you open to the side. Not touching rather beyond the 1-inch border. All right. I'll pull up. And then towards me last. Yeah. You see, I'm only touching outside portion. I'm pulling. Trying to be careful. Boom. This is the only thing I can do with my bare hand. If I'm going to open down on my sterile glove on the side, I encourage you to do this. Try not to open your sterile glove, put on your sterile glove with this, because then this package will have the tendency most likely to touch your sterile field. Okay, so just be mindful of that. Because I'm clumsy, all right, I'm just going to put down on my sterile glove right here. And notice my back is not towards my field still. Okay?
Question, do you leave the patient exposed like that while you do all this?
You have to.
Okay.
That's why privacy is very important. Because once my sterile glove is on, I cannot go and then uncover the patient. If you have a partner, which in reality, most cases you won't. If you have a partner, the partner can do the non-sterile procedure. So keep them covered, and then when you're ready, they can go ahead and uncover the client. But because I'm by myself, you're gonna have to leave them exposed. Oh, these are some good gloves.
Wow.
Went on like butter. Oh, okay. Right. All right. Boom. Sterile to sterile. And remember, my hand should not be like I'm in a club. It should not be like that. Only right here. All right. Now, I forgot to tell you. You see, the only thing in this kit you can touch with your bare hands is this glove, because with the intention that you might use it, but you can only touch like so. If my hands was non-sterile, if my non-sterile gloves went on, and then, but I'm not using it, it's okay for me to go ahead and touch it. I'm gonna just put it to the side. Okay. Boom. So you have this first sheet. I'm going to step back, and you're going to look for the shiny side. Shiny side is always going to be down. All right, so this shiny side. And I'm making sure, you see, I kind of hold like you could do like a little taco method. To lay it carefully. See that? What you don't want is for this sterile field, especially the non-shiny side, so to speak, you don't want that touching the client. If it does, you're going to have to start all over again. Or because really you have to start all over because you're going to need a new kit. Now, this right here is called a fenestrated drape. It is optional. Not everybody uses it. Okay? What you do is, again, open. It doesn't matter which side you lie it on, but the purpose of the drape is to provide more sterility, more sterile field, but you just want to make sure the opening is just enough so you can have access to the perineal area. Does that make sense? So, again, optional, not required, but if you do choose to do it, you simply lie it carefully on the client, and then, again, open it wide enough to cover the perineal area. All right? Leave it like so. All right, I'm just gonna leave it just like this so I don't mess with the feel more. Boom. You like that. All right. Now, just so you know, because some of you, this is your first time seeing the Foley kit, this is the 10 cc syringe that comes in the kit, lubricating jelly, and iodine. When I asked the client if they were allergic to anything, the client said no, so I can go ahead and use the povidone iodine. If they did say that they were allergic to iodine, I would make sure my kit did not have iodine. Instead, you could use the kit. Some of them come with a CHD solution instead, or some other solution. All right, boom. Now, I will show you two methods in which you can transfer your equipment from your sterile field here to your now sterile field here. One method is where you simply take, you're going to go with both trays, but before you go with both trays, I'm going to put this to the side because I don't need this now, and you're going to see your catheter itself is covered with a plastic wrap. Please be careful how you remove this Foley catheter from the box. You don't want this swinging all over the place all willy-nilly. You are being careful. One method you can do to remove it, I simply just do like so, and I wrap this around the catheter around my hand, or my finger rather, and then this goes. Okay, I'm not going to make it to the NDA, but it's okay. Now, carefully place it back into the box. Before I forget that too. You can go ahead and uncover the top. I won't need this, so I'll put it to the side.
It's already pre-filled with saline?
Already pre-filled with saline. And this is what I was talking about. How many cc's the box said for me to use? 5.
But it is 10.
It is 10. So one method you'll see some people do is they'll go ahead and discard the 5, up to 5, or they'll just, know to make sure they don't push no more than 5. Whichever you decide to do is fine, long as you do not push more than 5 cc's. Okay? Now, this is also optional, but I like to go ahead and connect the syringe to the port. That way I know I have one less thing to worry about once I get over there. Is it required? No. Okay? But I just know myself. Also, this is the moment where you're going to go ahead and I'll go ahead and show you the mess. Carefully. This does get messy. Alright. Since I'm showing you both methods, you can go ahead and remove what's here and place it into the kit. There's some more solutions here. You can go ahead and put that in there, and then you can dispose of this. We'll make it today. Yes.
Can you put it all on to there, since it's there, instead of dropping?
Yeah, you could do that. Long as you don't. Yeah.
Okay.
That's fine. That's actually not a bad idea. All right. And go ahead and open my lube. Again, I will show you a different method. All right. You can either go ahead and, put your lube here, or another method you'll see nurses do. This is what I like to do: is go ahead and insert the lube here into the catheter. That's another method. Is it required? No. Do what works for you. All right. Just because I'm showing you the one method, I'm gonna leave this here. Put this right here for now. Okay. Method 1 in transferring your content is to actually go with both trays and carefully place them on your field without breaking sterility. Okay? Boom. Now, that's one method. Another method
Be like,
another method is I like to just go with one tray. I am going to go ahead and insert my lube. Put that here. And you see the packet, the gray packet, I would just have left it right here on the side standing. Okay? But let's pretend, just for demonstration purposes, that the gray packet was here. Boom. And then I am going to go ahead and transfer. Now, one thing I want you to be cognizant of, you see here where the bifurcation is? You want your bifurcation closest to the perineal as possible, okay? The reason being is if my bifurcation is like so, away or facing away the perineum,
you need to cross. Right?
yeah, it's not that you need to cross. You'll have the tendency to play tug of war. It makes it a little bit more challenging for you, okay? What I like to encourage my students to do is just go ahead and make sure the bifurcation is closest to the perineum, all right? And then it makes it the access to the perineum just a little easier, all right? Now, this will now become my clean hand or non-sterile hand. I'm going to hold this back a little bit. Spread the labia open. You have to make that movement. Spread the labia open and take my iodine. Take one, go down one side, dispose. Second, go down the other side, dispose. Or if I want to, I can go ahead and dispose it here, but I know I'm not gonna make it, okay? And then the third one is in the middle. Again, remember, downward motion from top to bottom, in the middle, and dispose. Okay? I'm gonna go ahead and insert the Foley catheter, the catheter. Take a deep breath in. My catheter is well lubricated prior to insertion. Take a deep breath. And then my clean hand is still on the labia. And then I'm inserting. For clients with a vagina, I insert the catheter until I see a splash of urine going into the tubing. Once I see a splash of urine, for those with a vagina, I will go and advance about 1 to 2 inches or centimeters. I don't know. I forgot what unit. Okay. Centimeters, I think. Yeah, centimeters.
It's
okay.
a lot.
All right. And now that it's in, okay, hold this in, because I can hold this because this is no longer the sterile part is inside at the client, okay? And then I flush for 5 cc's. Okay, where's 5? Okay. And then I remove.
One hand? Oh my goodness.
One hand only. You notice I did a crawl method. When I did that crawl method, I try to go as close to the port as possible and then remove, so it prevents splashing. Pull back. Okay, it's not out. Good. And now I'm clean. You can go ahead and decide to go ahead and remove your sterile glove if you want to. I would remove it and put don on clean gloves to go ahead and now change the client. I can tear this apart. If this gets in your way, the fenestrated, you do not have to use it. Okay, if you don't like it. Not every healthcare provider uses it. Oops, too far out. Okay, and then I will take a rag and clean the client again from top to bottom as necessary, because there might be, it might be a little soil. And then, okay, this is the strap to hold the catheter in place. Okay, this butterfly looking thing with the wingtip is called a stat lock. You actually want the stat lock in place. Okay, this does not require sterile procedure. If this is in my way, I could go ahead and take this out. The hard part is done. You'll notice what it comes with is skin protector, because it's like an adhesive in the back. I apply the skin protector on the client. I want a little wiggle room so it don't pull. I don't want this like too far, so because it could, it risk coming out and harming the patient. So I'll just put it around here. So I'll clean the area. All right. Apply the stat lock. Make sure I put it this way. Okay, in the hospital setting, it's actually much different than this. So this stat lock, this is how I have to put it. And then you have this little extra taping. Okay, and then you're going to put this in a way so it doesn't get caught in the patient. This is very important. You're always going to hang the Foley catheter in the non-movable portion of the bed rail. So this is a stretcher. So you can put it right here, or there's a little hook also right here. That's where you would hang the Foley catheter. All right, in these areas. They usually put this when they're transporting the client. It makes it easier for some people for some reason for transport. Okay. All right. Also, per facility protocol, each facility will have their unique protocol, but they'll want you to date the bag. And some facility, in addition to dating the bag and putting your initials and stuff, they also want you to date the catheter itself. Reason being is, if you'll notice, you see this catheter, there's like a little yellow tape right here. If need be, we may need to either remove the tape to either flush the catheter, or maybe we noticed that the bag was no longer intact for whatever reason. So instead of going to do the whole Foley catheter system again, so we'll just remove the tape, remove the tubing, and then apply a new one, and then tape it all over again. But now, sometimes some facilities are very strict. They want you to use particular tape. You just follow facility protocol, okay? Huh? Then not every facility. Some are more strict than others, depending on the infection rate. Okay?
What was the iodine used for again?
To clean
The perineal area before you insert it?
Yeah, before you inserted it. Okay? Now,
What if they are like allergic to iodine? You just like skip that part.
No, you have.
She said you get a kit
A
with the other,
specific kit, yeah.
you get a different kit with the right.
So my students were paying attention. Like, Mason. Okay. Nah, that is for the vagina.